Nurses' work is more than just a source of income, it's a source of satisfaction. At the same time, experienced nurses are a precious commodity and their retention is imperative to the proper functioning of the workplace. But scenarios encountered at work by nurses illustrate a common dilemma in nursing practice. Many nurses are women of childbearing age, and finding a balance between work and family, service and safety may be challenging, especially for pregnant nurses. Like other professional women, pregnant nurses experience considerable pressure to minimize family-related work disruption and continue working throughout pregnancy. But given a nurse's potential exposure to environmental risks such as radiation, infectious agents, teratogenic chemicals and drugs, as well as the heavy lifting, prolonged standing, long work hours, and shift work nursing often entails, can pregnant nurses continue their professional work without risking adverse outcomes such as congenital malformations, pregnancy loss, preterm birth, prenatal growth restriction, and pregnancy-associated injuries? In this video, we look into the details of what pregnant nurses go through at their workplaces. Nursing is a vocation rife with occupational hazards. On daily basis, nurses come into contact with sick patients, infectious agents, teratogenic chemicals, and radiation, to name just a few environmental risks. Additionally, nurses are constantly on their feet, walking several thousand steps per shift. They are expected to help lift, move, and transfer patients several times per day and face many potential musculoskeletal injuries from strenuous physical labor. It's not surprising that many nurses worry about the risks inherent in their daily job descriptions once they are expecting. Many nurses are women of childbearing age, and a pregnant nurse has to take certain precautions to keep herself and her growing baby safe. Below are some of the hazards pregnant nurses may face and suggestions for mitigating those risks. Infection. Perhaps one of the most obvious risks to a pregnant woman and her fetus is infection. A nurse in the emergency department, for example, may encounter patients sick with potential pathogens, from sore throats to tuberculosis to the flu, and most recently to the common COVID-19 infection that is ongoing. A pregnant nurse should follow standard precautions with all patients and may also wish to wear a surgical mask around patients with a fever or suspected respiratory illness. A pregnant nurse from emergency department, for instance, may also wish to limit exposure to pathogens by reducing time spent in triage if possible. Pregnant nurses may wish to avoid taking care of patients with active shingles or varicella zoster infections, as well as patients on airborne precautions. During the winter months, influenza epidemics occur commonly throughout the world. Influenza is spread by respiratory droplets when an infected person coughs or sneezes. Influenza causes fever, myalgia, malaise, headache, sore throat, rhinitis, and vomiting, but in uncomplicated cases, it subsides within a week. In vulnerable populations, influenza can involve serious complications. Pregnant nurses should be immunized against influenza. The vaccine is safe for women in all stages of pregnancy. The live attenuated flu vaccine is unsafe for pregnant women. As an added benefit, flu antibodies are also passed to the fetus. If a pregnant nurse cares for a patient with influenza and later suspects she may have contracted the flu, she should speak with occupational health at her hospital to possibly receive a prescription for Tamiflu. Tamiflu works best when taken within 48 hours of symptom onset. Drugs and chemotherapeutic agents. Because several drugs and pharmaceutical agents have known phytotoxicity, great care should be taken by the pregnant nurse when administering such medications and any other drugs to the patients. Medication preparation is risky, and pregnant nurses may be exposed to hazardous drugs through skin absorption, inhalation, accidental contact, or needle stick injuries. Sometimes while drawing up medication, the liquid can splash or make contact with the skin. Nurses should at the very least wear gloves while drawing up any medications or handling drugs. At the most, should avoid handling known chemotherapeutic agents such as methotrexate. Waste anesthetic gases are small amounts of volatile anesthetic gases such as nitrous oxide or halothane that enter operating rooms during the delivery of anesthesia or are expired by patients recovering from anesthesia. Studies have suggested that there is a relationship between anesthetic gases and spontaneous abortions in OR staff. Nurses should also weigh the risks and benefits of continuing their particular field of nursing while pregnant. Cancer treatment drugs, for example, have known effects of infertility, miscarriage, birth defects, and low birth weights. Ionizing radiation. Radiation for diagnostic imaging is common in nearly all hospital departments, and nurses are at risk of background radiation and direct ionizing radiation. Nuclear medicine departments in particular are high risk to a pregnant woman. Effects of radiation on a fetus depend in part on the dosage of radiation and on the baby's gestational age. The thresholds of safe exposures are not well investigated, but research has demonstrated an or none effect. That is, significant exposures can cause either no effect or a fetal loss. Although dosimeters are used in areas where high radiation exposure is expected, other areas of high ionizing radiation, such as the emergency department, are rarely monitored. Expectant nurses should be very aware of their surroundings. Stress, physical labor, and shift work. It may be necessary for nurses later in pregnancy to modify their shift schedule or behaviors to help accommodate their needs. Nursing is already a physical, rigorous vocation, but add in the fatigue of pregnancy and it can be extremely physiologically demanding. In the first trimester, many women experience morning sickness, which to the pregnant nurse can be very debilitating. Later in pregnancy, back pain and sciatica can also interfere with nurses' ability to continue working until their baby is full term. Additionally, the 12-hour shifts typical for most hospital nurses become more taxing later in pregnancy, and it may be necessary for the pregnant nurse to request a modification to shorter shifts or part-time hours. The best solutions for pregnant nurses are to enlist colleagues for help when possible, to always use safe lift equipment when available, and to speak up when requiring assistance. In later pregnancy, the body's center of gravity is altered and movement is awkward. high serum levels of progesterone, and relaxing loosened muscles, ligaments, and connective tissues in preparation for birthing can also raise the risk of musculoskeletal injury, particularly during the performance of heavy, repetitive work such as lifting, pulling, or pushing. Relying on proper body mechanics, such as keeping the knees bent when lifting or avoiding twisting while carrying, won't prevent back injury, even among non-pregnant nurses who manually lift or transfer a debilitated patient or heavy equipment. Nurses are among the professionals with the highest rates of work-related low back pains, and every year, about 12% of nurses leave the profession as a result of back injury. Occupational risk factors for musculoskeletal back injuries include manual patient handling, made more difficult by the increasing frequency of obesity in the patient population, the pushing and pulling of beds and trolleys, the awkward positioning that's often required during patient care, and long working hours. In pregnant nurses in the later weeks of pregnancy, all such risks are exacerbated. On another note, pregnant nurses also have a higher risk of developing varicose veins due to an increase in total blood volume caused by pregnancy. The added blood volume, combined with being on one's feet all day, leads to poor circulation, puffy legs, and swollen ankles. Compression socks or stockings can help reduce the risk of blood clots and varicose veins as well as prevent swelling. Violent patients. Always keep safe. Violence against nurses is not uncommon, especially in the ER setting. Stay vigilant and keep away from any potentially threatening situations. If a patient is escalating towards violence, then leave and call for help immediately. Solutions to back injuries problems involve the use of patient lifting and transferring apparatus, biomechanical training, larger rooms, and additional staff to help with patient transfers. Staff shortages can precipitate incapacitating staff injuries, which in turn compound problems associated with staff shortages. Nursing researchers have pointed out that implementing a minimal or no lifting practice within healthcare institutions is associated with significant cost savings, as well as greater patient satisfaction and reductions in the number of staff's injuries. Pregnant nurses may rightfully request some job modification to minimize exposure to certain drugs, patient populations, gases, and solvents. For example, a pregnant operating room or recovery room nurse, particularly one in her first trimester, might ask to be more involved in pre-operative care than immediate post-operative care in order to avoid contact with the waste anesthetic gases post-operative patients usually expire. A pregnant oncology nurse must strictly adhere to guidelines on handling and administering cytotoxic drugs, although she might also request temporary alternative duty. Most countries have regulations protecting the right of women to maintain employment during pregnancy, but there are fewer regulations concerning the modification of workplace environments to accommodate the special needs of pregnant women. Safe workplace environments that serve both the professional and personal needs of nurses contribute to the retention of experienced and passionate nurses whom we can ill afford to lose. Ethical and humane accommodations allow most women nurses to continue working throughout pregnancy. Shortening work hours, providing assistance with lifting, accommodating the need for frequent nutrition and bathroom breaks, and considering pregnancy risks when making assignments can also promote health and satisfaction among pregnant nurses. However, there could be an unexpected benefit of working as a nurse during pregnancy. One of the best gifts that pregnancy can give to a nurse is to force some sedentary activities, although while you are carrying an extra 25 to 35 pounds of extra weight, you may not consider it a benefit. Many studies show that not moving enough during pregnancy is bad for both mom and baby. In fact, exercise during pregnancy can boost your baby's brain development and make them smarter. Who knew that working a 12-hour shift might promote health for both you and your unborn baby? Good luck to you during your pregnancy and take care of yourself. Thanks for watching. Subscribe for more interesting videos.